Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is December 13th, 2024, and it is a Friday. Luckily, we don't have the full moon. Let's actually just double check. I didn't check the full moon, so let's see. I don't know if you have a full moon calendar, but I have one. You should get one too. The full moon is on the 15th, so we're actually close. So hopefully, other than the 10 minutes delay, we shouldn't have any other issues, at least for this episode today. We have some difficulties. I look like a vampire, but we'll fix them in time. So I actually would like to start today's session just coming back from Turkey. Some difficulties most of you already know. So life is full of contrasts. Over the past couple of weeks, I have experienced some of the most challenging times of my life. During these moments, I have been reminded of incredible goodness that exists in some people. So let's just restart that part. So we had similar issues last week in the Turkey episode. As I was saying, life is full of contrast. And over the last couple of weeks, I have experienced the most challenging times of my life. During these moments, I have been reminded of the incredible goodness that exists in some people. Their kindness, goodness that exists in those, positivity and unwavering support. I'm deeply grateful for those who stood by me unconditionally. But life also has its shares of difficult individuals, as I call them, evil people. People we encounter daily as family, friends, colleagues, even in some cases, employees. These experiences have served as a stark reminder of contrast between light and darkness, good and bad. Today, I want to take a moment to express my gratitude, not only to those who uplift me and inspire me, but also, oddly enough, for those who have shown their true colors in a negative way. It is through those experiences that I have gained a deeper appreciation for the goodness around me. However, there are a few individuals whose actions are unforgivable, and they know who they are. Their choices they have made, a painful reminder of what I stand against and why I continue to strive for better in all aspects of my life. Being good is the easiest. You don't have to put too much effort. Being bad and evil, you really have to put a lot of effort into that. So my advice to these people, these individuals, and in this case, this is around my mom's hospitalization, having a wedding at the same time, my only niece, and living the life just the way it is with all aspects. So life is not all just good stuff, but it's also a lot of heavy stuff. Therefore, this is our lives, and we have to live this with dignity. And we have to respect first to ourselves so that we can respect others and we can be useful and helpful for those who may need us and who's around us. So hopefully people will make their choices, and then I'm going to actually make some future episodes, but they are going to be on a not live. One of my friends from Chicago actually is coming down. We are going to cover the Turkish health system. And because I'm a healthcare executive, so for me, someone who owns a surgery center, who owns several medical practices, for me, it was an extremely interesting experience altogether. So it's like not like time traveling, but more like being in a different dimension. So because it's not like the old times or the new times. So they have the technology, they have everything that they needed, but things that are missing, I want to cover those with Stefan Alaverdi. He's going to hopefully be here next weekend. if nothing changes. So we will be covering some of those issues with him. Now, since I've been away for the last 2.5 weeks, we had a lot of things happen here. So I'm going to try to connect this iPad again because I do want to try some new stuff with you guys. Let's see. It doesn't let me turn the volume off all the way down, but I'm going to try again. So, deny, delay, depose. Luigi Mangino or Mangino, like how do you say that, Ethan?
Mangione?
Mangione? Mangione, 26 years old. And this individual went through a lot. Now, it's kind of, speaking of these things for yourself, it's a little bit difficult because our company name is United Medical, and the guy who was killed is United Health, and he's 50 years old. I got only 5 messages and phone calls from friends of mine who are like, hey, are you okay? I'm like, clearly I'm okay because I'm talking to you. So, but this just happened. And this is this issue of this young individual killing UnitedHealthcare CEO and how actually it's being handled. It's extremely interesting, and in so many ways, it's so wrong. Now, there are a group of people who are actually supporting this guy. Now, for many of those who already, many of you already know who he is, what he has done, what his background is, but he's one of the wealthiest family members in Maryland. They own several country clubs, nursing homes, hotels. So he has a superior education from UPenn. He has masters, and it's just like everything that you can look for, he has it. Yet he felt like he needs to get up 6:30 in the morning and then go and kill someone. This someone is not just someone. This someone is he represents part of healthcare. And what I'm actually kind of really shocked by it. No one is looking for the real issue. Everyone is thinking that he killed this guy because of some insurance claim issues. Well, he's worth probably $200 to $300 million. So he doesn't need money, and he doesn't probably have to use his insurance for some of the things that he has to do. Now, if this is the fact that he definitely did this, well, there are still some ifs, and I don't know why, but no one is looking at the other side of maybe the real issue. In my opinion, and it's just an opinion, I think this guy, Luigi, Ethan, are we going with Luigi or Luigi?
Luigi.
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 We can put a little bit soprano accent. Luigi is probably, he had a love affair with this guy. That's just totally my guesstimate. Why I'm saying that? Because there's really no reason for this guy to kill this person. So, because of all these, what I'm looking for to see if they check their cell phones. Do they actually check the other guy's cell phone? Do they actually go back and look at how many times these individuals, if they talk? Instead of looking at those, they're just lost in all these different details that's really not helping. Because I think what they're trying to do is they're trying to make a case of, hey, this is an insurance system issue. Well, he's not a guy who's jobless, has 2 kids, and dealing with child support. Well, even if he had that, we have Medicaid. Medicaid covers everything. So no one in this country needs to actually go out of their way to kill someone to get their message across. So this is something more than a healthcare issue. Now, I did go through some of his personal stuff that was available online, and I would not be surprised if this comes down to some love affair issue. But I guess we'll see. At the end of the day, for those who are supporting this killer, those people have no morals. Like, we are a billing company, and I know how difficult to deal with the insurance companies. We know that. But that never means that we need to go out of our way to kill people. That's not going to happen, and that shouldn't be happening. And hopefully, they will figure out what is going on with this whole thing. So now, as we were getting ready for today's event, one of the things that I saw last night just reminded me of why Republicans are always going to lose in the state of Delaware. So why I say this, let me actually explain that. So I saw this news from News Journal, I think it was a tweet. Let's see. So they are holding a dinner event with this loser, Nancy Mace, who brought up we can change the video to the Sarah. So with Nancy Mace, who is trying to attack Sarah McBride's bathroom issue. Well, no one cares about this. Sarah doesn't care about this. This is not a real issue anyway. It's just some stupid publication that she's trying to get. But what was really interesting to me is in the Times Magazine interview, even President-elect Trump doesn't support Nancy Mace's point. And as Sarah says, hey, we have bigger fish to fry, so we need to focus on bigger issues. Rather than doing that, when they are trying to focus on this small, not only small, but stupid issue, and then trying to get people's attention to that. That's just like low. So as Sarah says, we should all be focusing on more important issues. And then Trump's answer to that question that was quoted by Sarah, he's like, I do agree with that. All that on that, absolutely. And all I was saying is, it's a small number of people, but we have bigger issues to focus on. So this is what state of Delaware's Republican Party is focusing on. Because I was always wondering why Republicans are not making it, because it's not a huge gap. But this is one of the reasons. So let people just pee wherever they want to pee. So this shouldn't be something that we should be discussing. All right. Ethan, what do we have?
I believe it's AI on healthcare. I believe how AI is impacting healthcare specs.
All right. So next week we have David Finberg is going to be with us. We are going to discuss the cloud in healthcare and several other new features of EMRs. So he is going to be with us, and then some of those questions I'm going to save it for him. But before that, let's see. One of the things that we were expecting is this Elon Musk Neuralink to take off, and then we even offer the partnership from the United Medical ACO side. We may need to actually reach out to them again, and understanding how AI is actually really helping. It is a huge benefit. Just like the way that we use the AI in our business. Now with the speed of AI, reaching out to the information that we need, sharing that information with those who need that. It's a speed of light. So AI is going to be even more useful in the future as we are using it, because it's still learning a lot of things. And hopefully we are going to be seeing a lot of those. And then I'll make sure that our questions related to the future of EHR, we are able to address those with Mr. Feinberg next week on Friday. We did discuss the post-surgery mental health issues, although we do focus on bariatric in our Bariatric Friday sessions. One of the things that we see is, and then because I just experienced this with my mom with the triple bypass heart surgery, the post-surgery mental health is it's crucial, because in many cases patients are in a denial. Now, in the bariatric surgery, because we prep the patients extremely well, so they don't have those problems. So they're well prepped for what's coming. But when you look at for those emergency surgeries, these are not an easy, straightforward cases. These are extremely complex cases. The surgery took 5 hours. So we couldn't see her for almost 24 hours from the time of the surgery to the next day. So, but then interesting enough, what I have seen with her is she doesn't remember why she needed to have the surgery. And we just keep going back to the same issue. Why did she have the surgery? I'm like, okay, so this is what happened. This is how we got to this point. And then all of a sudden, okay, so she remembers. But the next day we start all over again. So unless you have a really good family support, those, especially in our culture here in the United States, we may not have enough support. Having someone, a professional who's actually supporting you during those times is extremely important. Now, being in the hospital for almost 10 days, 24/7, that changed my entire perspective of healthcare, because for 25 years, everything that I know about healthcare, that's what I learned here. So being in a different domain with different dimensions, things were not what we used to have here. So patient satisfaction is not discovered yet. So, I always said when I was there, if we had any of these issues in United States, they would shut down our operations. So that's kind of like what we are going through. So that's why understanding and having the right support, they are going to be all important. One of the really, again, important issue that we have discussed with our clinical presentations, with Donna Gunkel's initiations of our webinars, the wellness webinars, and focusing on diabetes, but we also discuss all the other issues with diabetes. But prevention is the key. Prevention is everything. Prevention is a lifesaver. So delaying your annual regular blood work. So you may be the healthiest person, but you need a blood work once a year. You may be very healthy, but you need your mammogram, you need your colonoscopy, you need your cervical cancer screening. These are lifesavers. So this is whether someone is going to live or they're going to die. They're going to die in a painful way because they missed their colonoscopy. They didn't repeat their colonoscopy. So it's just like way too many things happening. And please make sure this is specifically for our patients who are watching these. Get your routine checkups. So make sure that you get in touch with us and have your appointments for those routine checks. So I'm going to go into the U.S. politics a little bit with the changes that we have. I think some of the board, the cabinet appointments are final, but they're not confirmed necessarily. There isn't any surprises, I don't believe. So they're actually pretty much on the regular. I don't think there was anyone changed from the cabinet, if I'm not mistaken, but we'll just double check. One of them is actually Mehmet Oz is getting a lot of attention as he's actually being nominated for administrator of Center of Medicare and Medicaid. And I think he's going to do an okay job. I got some criticism from some of my friends who are from Turkey. I'm like, hey, just give me a break. I mean, so I have to be objective. So I just didn't think that it was the right position for him. So he needs to learn a lot of things, but hopefully, he can, and he's staying there. So that's not changing. So what's actually happening in right now in Syria is also another important thing. This is all going to come back to us, and those are things that we were talking about. Now we may be seeing another Afghanistan like operation there because Trump is totally got out of the support that U.S. had in that area, but I guess Russia being so busy with what's happening in Ukraine, they don't have enough resources. So now they're actually not paying that much attention. But I think Turkey is pressuring them a lot. And now Trump doesn't want to actually support the Kurds, which may actually solve a lot of problems that we have as we are getting ready to have a new settlement in that area. This doesn't mean that some of the issues that we have with Israel and what's happening in Palestine is going to go away, but I think it may bring a different dynamic, different balance there. And that should be, I think that's a positive change. And also Russia not being pushing this and then Trump not supporting it. It's going to actually work out better for everyone. Now, the other thing is there was, if I can find this very quickly, there was a tweet from President-elect Trump regarding BRICS, and that was kind of aggressive. Being in Turkey for 2.5 weeks and not able to, sleep a lot didn't help. But the way that Trump is looking at BRICS is now that he sees the threat, and he's like, hey, this is not going to happen. So we are going to make sure we'll do everything in our powers to stop this madness. Now, this is what he calls it, madness. But I think that's also important for us to really pay attention. So I personally maybe own BRICS a little bit because I brought that up 2.5 years ago when no one knows about global currency issues. So now we do have a really good understanding of what this will do for us, and maybe Trump will take the right actions, because if you let this happen, there will be a huge consequences for the U.S. economy in the next 10 to 25 years. So something needed to be happening. And then maybe what I'll do is I'll prep that for next week for you guys. So as you can tell, I'm actually kind of losing my voice. So we have one more session with Dr. Erkan. So we are going to have a little bit short session today. The session that I did in Turkey with the Marmara Foundation president, Dr. Akkan Suver, it was an extremely important session. Marmara Foundation is one of the biggest and most prestigious groups in Turkey, and they have a lot of influence in Azerbaijan, Turkmenistan, that side of the world, but also in the Balkans, in Bulgaria, in Karadağ, in Greece, in other parts of East Europe, and some of the Middle Eastern countries as well. So he is an extremely powerful individual, and we had a really great session with him. And I think he's like, for those who may not speak Turkish, I think there should be a subtitle available. And then if that's not the perfect one, we can maybe try to edit it. But I think YouTube is doing a really good job with the auto translate. But it was a really good session. Hopefully, you guys can watch and enjoy that as well. All right, so Ethan, I think I can go only this much. So then, again, I'm about to lose the voice. So then I'm going to save a little bit for Dr. Erkan. So we'll stop for here. We'll stop today. And I think we have enough for today at least. So we'll be back next week. Now we have a 3 p.m. event with Dr. Erkan for Bariatric Friday. We are going to have a kind of an interesting actually session. We are going to cover gastric balloon, but we added another part to that, where we are going to talk about some of our famous individuals who are struggling with morbid obesity. So I think that's going to be, if I wasn't sick, it could have been more fun, but let's see how it's going to turn out. So we'll see you in 20 minutes. Well, thank you.